Hello, my name is Dr. Randall Kahan. I am the President and CEO at Woman Care, which is a very large medical practice offering comprehensive health care to the women of the northwest suburbs of Chicago. I also serve as the Director of the very new Center for Bladder Control and Pelvic Organ Prolapse at Northwest Community Hospital in Arlington Heights. I have been practicing medicine for 30 years, and during that time I have developed an interest and an expertise in treating all types of disorders of the female pelvic floor. These primarily include disorders related to urinary incontinence and pelvic organ prolapse. Today, I would like to introduce a video that will discuss a very common problem that affects over 18 million women in America: urinary incontinence. Hopefully, you will find some very valuable information in this video that pertains to your particular problem. And as you watch this video, please remember two things. Number one, if you suffer from incontinence, you are not alone. And number two, help is readily available. All you need to do is ask.
Living with bladder leakage or urinary incontinence can be challenging. It can interfere with your activities, intrude on your social life, and be just plain inconvenient and embarrassing. You are not alone. 1 in 4 women over the age of 18 suffer from urinary incontinence. Let's talk about it. What is urinary incontinence, and what are some common causes? Urinary incontinence is the involuntary loss of urine from the body. It can be frequent or occasional, a few dribbles to a total loss of control. It can be triggered by certain activities that cause extra pressure on the bladder, like lifting, running, coughing, or even laughing. It can also be triggered if the sphincter muscles aren't strong enough to prevent urine from leaking. Most importantly, it can be treated. The risk of urinary incontinence gradually increases with age. However, there are several other factors that can contribute to urinary incontinence, such as obesity, childbirth, or pelvic surgery. There are many different types of urinary incontinence, but the most common are stress urinary incontinence, or SUI, and urge incontinence, which can also be called overactive bladder, or OAB. Women can often show symptoms from more than one category, which is called mixed incontinence. If you experience any of these symptoms, talk to a specialist to ensure you find the treatment that is right for you. To learn more, visit www.femalepelvicsolutions.com.
Thank you very much for taking the time to learn about urinary incontinence. I encourage you to learn more at femalepelvicsolutions.com. On this website, there's a wealth of information on bladder leakage and another common condition in women, pelvic organ prolapse. On any of the pages, you can click on Find a Specialist to find a physician in your area that specializes in treating these conditions. Thanks again for your time.